What is the structural classification of anatomical joints? Imagine your body as a complex machine made up of many moving parts. Each part needs to connect and move in specific ways. That's where joints come into play. Joints are the points where bones meet, and they are classified based on their structure. This classification helps us understand how bones are held together and how they move. There are three main types of structural joints: fibrous, cartilaginous, and synovial. Fibrous joints are like tightly glued pieces of wood. They connect bones with dense connective tissue made of fibers. These joints usually do not allow much movement. Think of the joints in your skull called sutures. They keep the skull bones tightly joined, providing protection for your brain. Another example is the joint between your tibia and fibula in the lower leg. These are connected by longer fibers, allowing a little more movement, especially in the ankle area. Then there are gomphoses, which are peg-and-socket joints. Your teeth are held in their sockets by periodontal ligaments, which are a type of gomphosis. These joints are very stable but allow slight movement for chewing. Moving on to cartilaginous joints, these are connected by cartilage, which is a flexible tissue. They do not have a joint cavity like other joints. These joints allow more movement than fibrous joints but less than synovial joints. For example, the growth plates in your bones are cartilaginous joints called synchondroses. They are mostly immovable but allow some growth. Another example is the pubic symphysis, which connects the two halves of your pelvis. It is made of fibrocartilage and allows limited movement, especially during childbirth. Intervertebral discs between your spine bones are also cartilaginous joints, providing cushioning and flexibility. The most common and movable joints are synovial joints. These joints have a fluid-filled space called a joint cavity between the bones. This cavity contains synovial fluid, which lubricates the joint and helps with smooth movement. The bones do not directly touch each other in synovial joints. Instead, they are enclosed in a capsule lined with a synovial membrane. Ligaments, tendons, and muscles support these joints, helping to stabilize and control movement. Examples include your shoulder, elbow, hip, and knee joints. These joints can move in different ways depending on their shape and structure, such as bending, twisting, or rotating. Understanding the structural classification of joints helps us see how your skeletal system supports your body and allows movement. Fibrous and cartilaginous joints mainly provide stability and limited motion, protecting internal organs and maintaining your shape. Synovial joints enable the wide range of movements needed for everyday activities like walking, lifting, and reaching. This classification also helps doctors identify potential issues, such as joint injuries or arthritis, and decide on the best treatment.